We have the lowest number of hospitalizations since we started. Amen. And we have the lowest number of deaths since we started. Once again, same numbers yesterday, but on the 3-day average, we are at a new low. And you want to talk about congratulations and something to celebrate. That is something to celebrate. And we're basically at a number that is so low that it may even be statistically questionable, because when you get down to 24, you're talking about literally how doctors decide a cause of death in some situations that may have multiple reasons behind it. So we went up the mountain, we came down the mountain. That is the configuration of the mountain that we climbed together, the highest mountain. And we did it with a smart reopening. We have done over 3 million tests now in the state of New York. More tests than any other state, more tests than any country per capita. We do 2 types of tests. We do diagnostic tests, which are you positive or negative today? And we do antibody tests, which are, have you had the virus at any point? We just did another sample on antibody tests, 12,000 test sample, which is a very large sample, right, all across the state, to find out where we've been. 12,000 starting 5/1 to 6/13. So about 6 weeks, we did 12,000 samples to see where we are today versus where we were 6 weeks ago. Overall, the number in the state has gone up about a point. Positive, last time we did the survey was 12.3 statewide. It's now 13.4. So statewide, we've gone up a point. New York City has gone up about 1.6%. Long Island has gone up 2.7%. Hudson Valley, basically flat. Mohawk Valley has gone up 2.8%. Western New York down 2.8%. These numbers are telling and are significant because we watch the numbers. We watch the numbers on a day-to-day basis, but we watch them geographically also. And these are numbers that local communities should pay heed to. New York City, it's not good to see the number going up, but it's manageable. Long Island, we have to watch. Mohawk Valley, we have to watch. And congratulations, Western New York, and the other areas that actually declined. When you look at the increases by race, you see the African American number is higher, Latino numbers higher, and that's something we've been talking about. You further snapshot New York City, you can see the same basic factors and patterns in the numbers borough by borough. Bronx is up, Staten Island is down, Brooklyn is up a little bit, Queens is up a little bit. With these numbers, again, the numbers look very good. Statewide, they look very good for the regions, some areas better than others, but there's always been a variance from region to region. We're going to allow hospitals to accept visitors at their discretion. This was always a balance of public health versus the personal relationships and people who are in hospitals who desperately want to see loved ones and loved ones who want to see people in hospitals. But we're going to allow hospitals to start accepting visitors at their discretion, pursuant to state guidelines that have limited visits, PPE, temperature checks, et cetera. Obviously, we need to be careful, but we'll allow visitors in hospitals. Same thing with group homes. This Friday, the group homes can allow visitors. It is up to the discretion of the group home. They have to tell the state if they're allowing visitors. And again, they have to follow state guidelines, masks, et cetera. We've reviewed the capital region data, and we're going to go to phase 3 tomorrow in the capital region, so we're excited about that. We're excited about the U.S. Open is going to be held in Queens, August 31st to September 13th. It will be held without fans, but we can watch it on TV, and I'll take that. The tennis authority is going to be taking extraordinary precautions, but that's going to occur in Queens. Again, it will be televised, but no fans there.